Okay. 3, 2, 1, go.
Hi, this is Pamela. This time we're going to talk about captive board meetings, the why, the what, and the when. A captive, you'll recall, is when a group of facilities or structures or providers get together and decide to create their own insurance company and cover their own risks and losses. So one of the most important aspects of having that entity is realizing that it's basically running a new business. It's actually running an insurance company. And so it's important to formalize a lot of the components of that organization in a way that you have your board members or whoever's going to be involved in the decision making for the group have the ability to actually take their facility hat off and put on the hat of this new captive insurance company or risk retention group or whatever you want to call it, self-insured trust, but to literally walk away from their responsibilities for their individual group and instead be thinking about the viability and success of this new entity. So holding the board meetings become a really important aspect of this management. And depending on what domicile you're in, you either need to have a board meeting every month, every quarter, or every year. And the location of the board meeting is also going to be dictated by the domicile. If you're within the United States, then chances are good you can just have the board meetings located where you're located. But if it's offshore, you'll find that there's requirements to actually go outside of the United States so that you're truly showing that the business being conducted by the captive, the risk retention group, or the self-insured trust is outside of the operations of the walls of the United States. So you actually need to take that board meeting and host it someplace else. So when we have a board meeting, or before we have one, we want to ask a couple of questions. So we always want to have a purpose identified ahead of time. What are we going to try to accomplish at this meeting and walk away with? What goals or resources do we want to be able to finish the meeting with? Who needs to attend? Do we already have board members? And if we do, obviously they need to attend. But what if they're not available? Do we have some backup plans? Do we have vendors or service providers that need to join with us? Typically at a board meeting, we're going to have not only the board members, but you're also going to have someone from the actuarial firm that works with it. You may have someone from the brokerage firm. You may have somebody who's in the role of captive manager. You may have someone from a third-party administrator. So your meeting may actually be much more extensive than just the group of board of directors. Of course, the board of directors are going to be the ones who have the actual votes for the decisions being made, but the other individuals are going to be the ones who actually bring the information to facilitate the discussions and get to those decisions. We also want to focus on really the time frame, making sure that it's as effective and efficient as possible. You know, typically our board is made up of individuals who have other jobs, other commitments, other focus. And so getting them to quickly focus, be effective during the meeting, and be able to get back up to speed with what was happening at the last meeting to this meeting is going to take some planning. Because one of the things that we don't want to do is have to revisit the same information each time this group gets together. That's not going to be effective. So here's a typical board of directors type of structure for, we'll just generically use the word captives for the rest of the presentation. So we have that group of board of directors, and typically it's under 10 people. Those are the ones who have the votes, who actually are responsible, fiscally responsible as a fiduciary of this new organization. Then we have committees within the board. So typically that has one or two board meetings or one or two board members. And then we might have membership with the different service providers. We might have additional individuals from the different facilities or practices involved as well. But the board members themselves are the ones who hold the votes for the decision making. So what you see here is we have always a risk management committee, We'll have a claims management committee, underwriting, and finance. Some groups will try to combine risk and claims. I usually recommend against that because if you do combine them, it's easy for the claims management aspect to dominate the conversation. So better to separate them so that you're truly letting risk management have its own portionment of time. And you can talk about things like risk initiatives and trends and those things that may get lost in the claims conversations. We'll want each of these committees to have their own meetings periodically during the year and then get together for the big annual meeting. So for that annual meeting, what we have here is a sample agenda. And what you're really looking for is, of course, that group of prior minutes. You're wanting to make sure that this group is get back up to speed quickly from what happened since the last meeting, since these meetings are typically annual meetings. And then you want to start with the finances. Talk about the financial review of the program, and then break out into the committee member reports, and then ultimately into the forecast of activities going forward. Now, why do you want to start with the finances? Well, typically a captive for, let's say, a group of 10 to 15 hospitals may have money invested in assets in the $40-60 million range. This is a big business. And so by starting with the financial discussion, it turns everyone's attention to the fact that this is truly its own independent business, and it's a substantial one. And so it tends to have a bit of a serious part of the conversation happening at the front end, which is a good reminder for everyone on the board that this is, in fact, a business that needs to be taken seriously, that it is separate from all of the other entities they might be involved with. And it really just puts them more in probably their fiduciary mood, if you will, to really focus on what's going to be best for this organization. We also want to make sure that one of the things that we touch on this agenda you see under forecast of activities is this ongoing conversation about what our exposures are. We may be a captive that has only hospital exposures. We may be a captive that has hospital and physician exposures. We may have other coverages in the captive. And so making sure that we spend time reviewing at each meeting exactly what it is that we're covering and what we intend to cover and what we don't intend to cover in this program so that our funding is appropriate. One of the key places I always start, especially if we have annual meetings, is just having a conversation about the domicile we're located in. Now, the example you see here is a bit of data about Cayman, which is the #1 captive domicile for healthcare. It is an offshore domicile, and it is regulated by the rules of the Cayman Islands. Fortunately, those rules tend to be pretty flexible, and they understand healthcare from the US perspective. And so they're a pretty savvy group. But it's important for our board members to understand that while they're running this insurance company, the insurance company has to comply with the various regulations of the different domiciles. So need to always revisit that, make sure we understand what's happening in our domicile and that we're in fact addressing any requirements that might be there. The next thing we want to do is just make sure that everybody's talking the same language. A lot of these phrases that you see listed here are not phrases, words that we would use in normal conversation outside of the board meeting or outside of the captive discussions. So we always want to supply the board with kind of a reference list of terms so that as we're having conversations, they can quickly reference what it is that we're talking about. Oh, yes, that's what that means. So you're not wasting time having to revisit language requirements, those kinds of things that really can just be best referenced by a little cheat sheet included in your board materials. It's kind of a simple thing, but it actually helps quite a bit when you get into some of the more focused discussions. From a risk management standpoint, when it comes to the risk management and the claims management committee meetings, one of the things we really want to emphasize is this is your chance to shine. Some risk managers serve on their boards, others serve as service providers to the board. Whatever your involvement is with your captive board, make sure that you're making the most of that time and that exposure. So before they ask questions, you're going to want to make sure that the materials that you present are as focused and comprehensive as possible, so that your board can review the documents, respond quickly, feel like they're educated on the decisions. Because once they're in that mode of being in that mindset of being a fiduciary for this business, they're going to be more apt to perhaps decide a little factor in the business's favor than if you have to take that conversation and fulfill it later, following up with information or bringing in additional facts or data. Then you kind of lose the momentum. So it's just really important to think about what can we share in a condensed way that's going to allow them to feel comfortable with not only what we've done so far, but with any resources that we're asking for. So here's just a real simple example, but when we're putting together board materials, we want to make sure that we're taking care in presenting the information in a way that's going to be beneficial to us. And beneficial to us basically means that we get the board, to understand why it is we're asking for things. So here's an example of a kind of a fair statement in a piece of board material compared to what we would call great detail. And you see, it takes a little bit more space, a little bit more words, but when you read the second category, under the great category, you understand the initiative, you understand what we've accomplished, and now asking for resources or advising as to challenges or things that have come up is going to be much more effective, because just in those two paragraphs, the board now has enough information to be able to go, oh yeah, I remember this particular initiative. I remember where we were. Here's the details. Yes, I'm now going to be listening when you tell me that you need to expand it or ask for resources or whatever the case may be. So just a real good opportunity, since they're already in that mindset, to make sure that you're giving them the detail that they need to be able to give you what you need when you go back to the program. The other thing we want to make sure that the board talks about is looking at what the next steps are for the captive or the group. It's very easy sometimes to focus on an agenda that's simply task oriented, where okay, we've looked at the finances, now we've looked at the underwriting, now we've looked at this, that, or the other thing. What we really want to do is make sure at some point in the captive meeting, we have conversations around more expansive opportunities. Things like, what are other programs our size doing? What do we want to plan for the future? And probably one of the most important conversations is, what do our exposures look like for the future? Maybe today, as we sit here in the board meeting, we only insure hospitals. But one of our goals is to move into insuring our physicians. That's a big conversation, and that has huge impacts for this program. What about the flip side, where we have physicians and hospitals in our program, and we decide we really don't want the risk of the physicians, and we're going to move them to commercial programs? Again, that has huge ramifications for this program, and so we need to have a conversation around that. So making sure that your agenda has time, and not just at the end, but has time in the context of the agenda to be able to allow some good discussion time around these types of questions. Now, one of the great things about captives or risk retention groups or self-insurance plans is that they don't have to just do professional liability. They can do any coverage you want to bring into that program. In fact, one of the best practices for captives is to be able to diversify the risk by bringing in different types of risk. so that the risk that you're funding isn't just all one grouping. So if you have professional liability and you also have workers' comp and you also have cyber and maybe you also have employee health, all of that is going to help offset the risk of each other. And it ends up being a more solid program. So we see a lot of programs where the board will make decisions to focus on the growth of the organization and to look at ways that they can continue to bring in additional insurance products and exposures, which then allows them to stop paying premiums on the commercial side. So again, an important conversation. The other thing is just making sure that we understand what the marketplace is doing. There's going to be rules and regulations that change as time goes on, as the financial markets change for the better or for the worse. It might impact the captive markets, it might impact the domiciles. So we want to make sure that our board, again, is being very strategic in some of their conversations about where they want this organization to go and how they're going to get there. And this is where going back to having the original philosophy for the risk financing program comes into play. Because when you're talking about growth and looking at expanding or whatever you want to do with your captive group, you're going to want to pull out that philosophy statement and say, here's where we thought we were going. Is this consistent with where we are and where we want to be? And you may find that it may change the course of discussions, or you may end up changing your philosophy statement. So just really important to be prepared for those types of conversations. The last piece really is the actuarial data that you will hear us discuss in other sessions. But the pieces of that actuarial analysis that focus on where are we compared to where we expect to be? How many claims do we have? What kinds of exposures do we have compared to where we thought we would be? Remember that the actuarial analysis is based on 10 years of historical data. So we may see where those last 10 years were much more conservative than what we're seeing in today's market, or vice versa. And so we really want to make sure that the board takes the time to go through some of this detail. We look at things like ultimate loss. Ultimate loss, as you'll recall, is going to be where we are looking at current reserves plus anticipated exposures, otherwise known as incurred but not reported. And basically what this is this is a comparison of what have we funded and is it enough? Do we need to add more? Do we see that there's going to be a shortfall in one of the years that we're covering? Or have we done a good job and we're really on target in that regard? So this is another area where the board's going to look. And lastly, we really want to just, again, talk about what's our exposure for this program, what do we want it to be, and making sure that we're on target with this. In some of our other sessions, we'll go into much more detail on the actuarial side of things to make these charts a little bit more understandable for you. But the key with the board is to keep it high level enough that they don't get lost in the detail, but also keeps them focused on giving them some real benchmarks for where the program is compared to where we thought it would be when we revisited it a year ago. There's never an end to the conversations you can have with your board, and that's why it's really good if you are going to have meetings that you take the time to really schedule in the discussion pieces so that you get beyond the tasks and you can spend some time being strategic. And you'll find that most of your board members are actually going to enjoy that part of the meeting the best. And so they're going to be much more engaged. And engaged board members are what we really want, because they're going to be the ones who understand why we're pursuing certain risk initiatives and why we may be asking for resources for those initiatives. Thank you, and thanks for joining.